Okay? And she denied any recent injury or previous injury. Okay? So then I'm just going to lightly go around the area to feel for any restrictions. Okay? I'm also going to use the patient's subjective to guide me as well. Was it left or right or both?
Both.
Both? Okay. So I'm going to feel around. And again, this takes practice because it's not easy. So some people's trigger points are very obvious. Others are pretty latent. Okay? So you just gently scan your fingers over the surface. Okay? Pushing down if need be. All right, I feel one right there. Now, if I push down, how does that feel to you?
Tight.
Okay. Go ahead, Al.
Now, when you say restriction, do you mean like the first bump you feel?
Nodules. Okay, if we're doing trigger points. Okay? So then what I do is I apply some pressure, and I verify with the patient. So then I'm going to say, okay, I want to push nice and hard. I want to keep it sustained there. It's got to feel uncomfortable. I want to do it for about a minute just to start. Okay, Danny? Now, let me know if it's too much to tolerate, because if it is too much for them, I don't want to continue. But I tell them, it's going to feel uncomfortable for now, but once I let go, it should feel better. Okay? Is it all right if I continue?
Sure.
Okay. So then what I do is I just apply, depending upon the area and the size of the nodule, I'm going to apply pressure either with one finger, a couple of fingers. I may need to reinforce it with my other hand. Okay? Just directly down onto the spot like so. Okay? Now I can't see her face, so I'm really going to have to communicate with her to make sure that I'm not hurting her, but I'm also trying to accomplish what I want to accomplish. So Danny, how's that feel?
Okay.
Okay? If it's too much, tell me, and I'll back off. If it's too much to tolerate, okay? Mm-hmm. Okay, so that's very important, especially since their face is down. You really want to establish the communication with the patient. Okay? So what you're doing as you're actually applying the pressure is you're trying to feel, is that nodule relaxing under my fingers? Okay? This is when the practice comes in. You're not going to be able to feel this right away. And again, I'm also going to ask the patient, Danny, how's this feeling now? Is it starting to loosen up or does it still feel tight?
It still feels tight.
Okay. So that means I should either alter my pressure or alter my location. Okay? So how's that feel?
Super tight.
Super tight. Okay. Is this pressure okay? Should I back off?
It's okay.
Okay. All right. Okay. It's okay. Well, I should say that. Okay. But this is how you make sure that the patient's okay with the treatment. This is how you are continually reassessing your technique. Okay, Dan, how about now? How you doing?
Okay.
Still with me?
Yeah.
Is it getting easier or still the same amount of pain?
Easier.
Okay, good. And you can tell she's easier to understand now. Okay, that's another way that she's telling me she's accommodating with this pressure. Okay, so let's say it's been about a minute. Now don't just like leap right off. Just slowly back off your pressure so they can get reaccustomed. Okay. Now, can you all see the area of redness as well? Mm-hmm. This is the erythema that you want. Okay, for you who have cameras, come on in. Okay, make sure to get that redness. As you're doing that, Danny, how's it feel now?
Better.
Better. Okay, I like the word better, but better isn't exactly very subjective. Very objective for me. So if I had already given her, like, it's a shoulder, right? So maybe I already given her a dash. Maybe I would ask her to fill it out again, see if there's a difference. If I did range of motion, I'll just reassess that quickly. If I did a pain scale, I can even use that as a reassessment. So let's do that right now. So before I applied that, Danny, how'd that feel on a scale of 0 to 10?
Before?
Yeah.
You applied it? Like 10 being the worst?
10 being the worst.
Probably like 6 or 7.
Okay. How about right now?
Probably like a 5.
Okay. And I only did it for a minute, but at least it's trending in the right direction. Okay. Any questions with that? Oh, sorry. Go ahead.
How long do you necessarily hold?
It's a great question. What do you think?
It depends.
To start, it depends. But to start, try a minute. Okay? Because again, you're going to really have to educate the patient. Now, you don't want to do this repeatedly on the same spot. So, as you're doing it, if you're getting a benefit, see if they can tolerate it a little bit longer. Because you don't want to say, oh, 1 minute's done, let's do it again. Okay? Because now they need to get adjusted to the new range of motion that they can accomplish because of less restrictions. Okay? Go ahead.
For people that are like more muscular,
Okay.
finger pressure is like not much. Can you like do like elbow?
Yes, you can.
Okay.
Again, it really all depends on the patient's tolerance. It depends on the area and location you're working on. It also depends on how deep the restriction is, whether it be muscle or whether it be fascia. Okay? Again, you remember dissecting fascia from anatomy? You remember how thick it is, especially in the back and the legs? Like that IT band. Did everyone appreciate how thick that is?
Yeah.
Okay? When we get to the hip, you're going to hear me stand on my soapbox a lot about you don't stretch fascia. Okay? You can mobilize it, but you don't stretch it. Okay? But again, depending upon the person, depending upon the body type, depending upon the location of restriction, yes, you can. Okay? Any other questions? Go ahead.
Would you treat them like, say they were seeing you twice that week? Would you ask them about it when they came back
Yeah.
the second time and
I
maybe
absolutely
do it
would.
again?
Because what I didn't touch upon yet is the follow-up care. So I would explain to the patient at home, it may feel sore. So if it's sore, apply some ice to the affected area. Now, I also don't lie down on an ice pack for 2 hours. 10, 15 minutes at a time and see if that helps. That's what I explain to the patient. Okay? Because you don't want them to go home unprepared. Then they're just going to blame you. And of course, you document everything.
Are you gonna get bruising with that?
You could, okay? Because again, depends on the patient. Okay? Now, if you did a good subjective, take a good medical history, you should have already known that. Okay?
After you do all this, would you want to apply heat or ice?
What do you guys think?
Nice.
And why?
Wait, ice or heat?
I think Toby, you said that? Yeah. Blood flow. What does heat do?
Increase
Increase
blood flow.
fluid, right? Ice restricts it. Okay? Yeah. So, again, if they're still really globally tight, or maybe I just didn't get enough and I don't have any time anymore to continue, maybe I would put some heat on it. But if my objective is to make sure that there's no bruising or an expanded area of redness, I would put some ice on it. Okay? Now, again, even after an ice pack, follow-up instruction is crucial. Because let's say you did that for 3 minutes, you loosen them up, and then you put an ice pack with their arm down at the side and they do nothing. What happens? It's like you did nothing. Okay, so it's very important to follow. Okay. Go ahead.
If they were taking blood thinners, would that be like a...
That's something I need to know
yellow
too.
flag?
That would be absolutely a yellow flag. You guys know yellow flags are, right? Precautions. That what precaution means is that's not necessarily absolutely not. However, I proceed very carefully. And that's one, a blood thinner. If they are on blood thinners, okay, I definitely want to know. And again, you'll get that from your subjective. Then I would maybe reconsider doing this. Maybe do a little bit, but not to the point where there's a lot of redness. Okay, because again, you never know. You might put them in danger. Okay? Any questions about that? Let me go look at all the other techniques. Also, all the instructions are up there.